Now that we understand the criteria and different classifications of hypertension, let's discuss the specific harm it causes to the human body and its related complications. Complications refer to new problems or diseases that arise during the course of a disease or treatment that are related to the original disease. Simply put, it is a case of one disease leading to another. You already have one disease, and then because of that disease or its treatment, a new disease arises. Disease A causes disease B, and disease B is the complication. Alright, next, I will introduce the main risks of hypertension to the body. The first risk of hypertension is its impact on the heart. Hypertension poses a particularly severe risk to the heart. It causes the heart to endure prolonged high loads, leading to ventricular hypertrophy and enlargement, which can result in heart failure and arrhythmia.
There are also lifelong risks such as high blood pressure, which can cause a heart attack, and protein-losing nephropathy.
2. Stroke. A stroke occurs when blood circulation to the brain is suddenly obstructed, causing brain cells to die due to ischemia or hemorrhage within a short period of time, resulting in acute dysfunction of bodily functions. Hypertension accelerates atherosclerosis, narrowing the arteries in the brain and obstructing blood flow, ultimately leading to stroke. 3. Harm to blood vessels. Hypertension accelerates vascular hardening, causing significant damage to blood vessels. Severe cases can lead to aneurysms, which are dilations of arterial walls. Hypertension increases pressure on blood vessel walls, potentially leading to aneurysm formation, especially in the aorta and cerebral arteries, which is highly dangerous. If the aorta ruptures, it can cause severe bleeding and be nearly fatal. If a cerebral artery aneurysm ruptures, it can lead to cerebral hemorrhage, causing a stroke with severe consequences.
The aneurysms look mycotic, but they're not. They're inflammatory. It's because it's not a fungal infection. The hypertension was a real symptom. I've been unwittingly treating it with beta.
4. Damage to the kidneys. Hypertension damages kidney blood vessels, causing glomerular damage and reduced kidney filtration function. Over time, hypertension may lead to chronic kidney damage, which can progress to kidney failure, uremia. Uremia can only be managed through dialysis or kidney transplantation to sustain life. The 5th risk of hypertension is damage to vision. The eyes contain a rich network of blood vessels, particularly the retina, which has numerous tiny blood vessels. Elevated blood pressure can exert significant pressure on these small vessels, and prolonged hypertension can damage the blood vessels in the eyes, leading to retinal ischemia, bleeding, and edema. In severe cases of malignant hypertension, this can result in permanent vision loss. The above are some of the main health risks associated with hypertension. The primary risks of hypertension lie in its damage to vital organs such as the heart, brain, kidneys, and eyes. If hypertension remains uncontrolled or untreated for an extended period, it may lead to various complications. Therefore, it is crucial to detect and prevent hypertension early. However, most hypertension patients have no symptoms, and only a small number may experience some symptoms. As blood pressure continues to rise, more noticeable symptoms may appear. Now, I will discuss some of the early symptoms that may manifest in hypertension. 1. Headache. Headache is one of the most common symptoms of hypertension. When blood pressure rises sharply, blood vessels in the brain may dilate or spasm, stimulating the nerve endings around the blood vessels and causing a headache.
I'm Dr. Carter.
Tom Angevine.
What happened, Mr. Angevine?
Going to a lunch appointment, then I get this sudden blinding headache and straight into a tree.
Pressure's 210/160.
Do you have a history of hypertension?
Yeah, I'm taking Vasotec and Lasix.
Headaches caused by hypertension are more noticeable upon waking in the morning and may subside as the day progresses. The second symptom is dizziness. Hypertension can cause unstable blood flow to the brain, leading to dizziness, especially when standing up suddenly or changing body positions. Dizziness is particularly noticeable in such situations. 3. Blurred vision. Hypertension can damage blood vessels in the eyes, leading to blurred vision. Some people spend a lot of time lying down and using their phones or computers, while others experience rapid vision loss. If your vision deteriorates rapidly, it may indicate an underlying health issue such as hypertension, diabetes, or hyperthyroidism, which can severely affect vision. 4. Chest pain. Hypertension can increase the burden on the heart. The higher the blood pressure, the greater the pressure on the heart, which can lead to chest pain or angina. However, if the chest pain is severe and accompanied by symptoms such as difficulty breathing, nausea, or sweating, it may indicate a heart attack. 5. Tinnitus. High blood pressure can alter blood flow in the ears, leading to tinnitus, which is the perception of ringing or buzzing sounds in the ears despite the absence of external noise. Tinnitus is also a common symptom among patients with hypertension. 6. Fatigue or weakness. Long-term hypertension may lead to insufficient blood supply to the heart and other organs, resulting in physical fatigue and weakness. Many middle-aged individuals experience fatigue, and in such cases, it is advisable to check if their blood pressure is elevated. 7. Facial flushing. Elevated blood pressure can cause vasodilation, sympathetic nerve stimulation, and accelerated blood flow, all of which increase blood supply to the face, resulting in redness and heat. 8. Frequent urination or reduced urine output. Due to the impact of hypertension on the kidneys, some patients may experience abnormal urine excretion, such as frequent urination, reduced urine output, and edema, especially in the legs. This is because the long-term burden of hypertension on the kidneys and heart may lead to fluid retention, particularly in the lower limbs or ankles. The above are some symptoms of hypertension. These symptoms are often not noticeable in the early stages or in mild cases of hypertension. Most symptoms only become apparent when the condition is more severe. Additionally, some symptoms may not necessarily indicate hypertension, such as headaches, dizziness, facial flushing, or fatigue, as many people without hypertension may also experience these symptoms. Therefore, if you notice any symptoms, it is essential to measure your blood pressure, as measuring blood pressure is the only way to determine whether you have hypertension.